Into your health today, April is Minority Health Month. Today, we're focusing on diabetes in the African American community. Joining us live is Dr. Melinda Zabramba, the program medical director at Miami Valley North Hospital. Thank you so much for joining us, Dr. Zabramba. What can you tell us about the disparity in the African American community when it comes to diabetes?
Hi, yeah, thanks for having me. So, approximately 4.9 million African Americans have diabetes in the United States, making up about 19% of the African American population, which compared to non-Hispanic whites is about 7%. So, definitely a big difference, approximately 77% more of a risk of having type 2 diabetes if you're African American.
And it's also having a very significant impact on mortality rates as well, correct?
Absolutely. There's increased risk of going into dialysis, hospitalization, and then, of course, also death.
So what can people do to be proactive about their health, knowing that they might be more susceptible to diabetes?
So some of the risk factors for diabetes are, of course, being African American, but also being overweight, and if you have a history of high blood pressure. You also have a very, very high chance of having diabetes if it runs in your family history. So I recommend to patients to know their status, make sure that they're getting their regular checkups with their doctor so that they can be screened. Because one of the biggest things is to find out soon so that you can make a difference on your outcomes later on.
To find out if you're higher risk. That makes sense. Last question for you, Dr. Zabramba. What can healthcare directors or employers perhaps do to help their employees or people in their community be proactive about their health?
So one of the biggest things that can help with diabetes, even once you're diagnosed, to help control it is to remain active. So programs that keep their employees moving, also making sure that you have healthy options, because diet and exercise most certainly play a significant role in both developing and the course of diabetes.
Dr. Melinda Zabramba from Miami Valley Hospital North, thanks so much for joining us to talk about this. Plenty more to come here on 5 on 2.